Hi, this is Dr. Toby, your host on Health and Wellness with Dr. Toby. Don't touch that dial. We have an awesome program for you this week with Dr. Myrna Alexander, professor of cardiology at the University of Mississippi Medical Center, the first female interventional cardiologist in the state of Mississippi. What a great way to celebrate National Women's Month. She trained at Tougaloo, went on to Meharry for medical school, and then pursued her cardiology and interventional cardiology at Henry Ford Hospital in Michigan. Returned and started a family, got married, has a son. She's a wife, she's a mother, she's a daughter, she's a sister, and she's also a faith-based practitioner. She believes in the sanctity of life, and she believes in the dignity of a human being. You will love to meet this lady. She's out of Biloxi, but she's touched the world with her generosity and her love. You don't want to miss this show. And just on the side, she's bringing her sister, who's an internal medicine doctor, alongside. Jesus is Lord. God bless you. Hi, this is Dr. Toby, your host on Health and Wellness. Don't touch that dial. Privileged to host a professor of cardiology, the first female interventional cardiologist in the state of Mississippi, a colleague, a friend, and a daughter, a sister, a wife. And she's going to be sharing her heart with you and I today on her career, her path to where she's gotten so far, and you know how life has thrown her some curveballs, but she didn't let those throw her off her life circle. She went to Tougaloo College and then from there to Meharry for medical school, and after that she went to work for 3 years and then pursued cardiology and interventional cardiology in the University of Michigan system, and then came back home to Mississippi and currently is a professor of cardiology at the University of Mississippi Medical Center. So we're privileged and honored to have Dr. Myrna Alexander. I hope I got it right this time.
You got Nickens, right.
Myrna
There's a lot of
Alexander.
names, right, yeah.
Yes,
That's
yes.
my husband's name, Nickens.
So we're so excited to have you on the show. And like I said earlier, you're one of the few female interventional cardiologists in the United States. And we know that there's still this discrepancy in African Americans in medicine. If you look at the statistics, 6% of all medical school graduates are African American. And it's been the same in the last 40, 50 years. If you go back to the 70s, it was 5 to 6%.
Right.
In 2020, it's 5 to 6%. And African Americans make up, I believe, at least 20 to 30% or so of the population. So there is a discrepancy in that. And when you look at the females have actually done better than the male African Americans. So we must give kudos to our females. But there's still also a lag in our female physicians in general, and then female African American physicians as well. So how did you pursue medicine in an age and a time when people didn't think female African American physicians were the go-to people? I mean, I'm sure when you were pursuing medicine, there were people who said, this is not a woman's job, this is not the kind of thing I expect you to pursue. I want you to be a wife, go home, take care of your husband, have kids, and look after the house. I'm sure there were people who made those snide remarks when you were growing up.
There were not many. You'd be surprised. No, there were not many. Most people were very encouraging. My church, people at my church were very encouraging. Like I said, we grew up in an era that education was a big focus. So it was not a big discrepancy between the men and the women at that time, because we felt like we were all in one pot, that we were all trying to achieve something. So when I came from a large high school. There were over 550 students that I graduated with.
Wow.
And so I wanted to go to a small college because I felt like I was one in lots of people in high school. So that's one reason I chose to go to Tougaloo College. But I did not have that many people say, hey, you need to be at home cooking. I didn't. One of the reasons is because I went to Tougaloo, and they are very nurturing and always have had people in the forefront. Didn't matter if you were
Right.
male or female. Actually, the people that encouraged us were Caucasians
Oh wow.
and East Indians. Those were the people that were our teachers.
Right.
So at Tougaloo, one of my professors, Dr. Richard McGinnis, he was one of the people. He didn't really pick one person. Really didn't pick me as to be a cardiologist. He was so surprised when I went back to Tougaloo that I was a cardiologist. He was, that was not. He, I would have not been the person he would have
What
chosen.
did he teach you?
He taught me general chemistry.
Oh wow.
General chemistry was one of those classes I prayed for. I remember praying, Lord, let me just have a B, please, 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 because I know I don't have an A. But can I get a B? And I did. And but I was a chemistry major, so that meant I could not have any C's in
Wow.
anything I did that was in chemistry. But he was a physician that was from Harvard,
Okay.
and so he felt like you all can do whatever you want to do.
Mm.
You just have to study and put your mind to it. And that's the way we led ourselves as well. He
Wow.
encouraged us to apply to other places,
Mm.
mostly outside of the state at the
Okay.
time in the 70s. Most of us um, applied to schools outside the state, which is changing. I'm at UMC now, and that part we're trying to get people to stay at the university,
Hmm.
stay in our state to provide the care for the state.
But one of the things I'm amazed at, your parents were not concerned about you leaving Biloxi, which is 4 hours away from Jackson,
No,
and
my
they weren't
dad
even
was
concerned about you going to Nashville, which is 7, 8, 9, 10 hours from Biloxi.
Now let me tell you, my parents were the kind of people that kept. We have a large extended family as well, so we would keep up with the sisters and the aunts and those kind of. So when I went to Meharry, my aunt was there, my
Mm.
dad's sister. So it was like I just left from home, and now
Another home.
I was in another home, and now my aunt is like another mother. Really, she was. A friend, a mother, a aunt. She taught me how to play golf. I mean,
Oh
so,
wow.
yeah. So
What was her career?
she was an atypical. I tell you, she's an atypical person as well. She was a school. She got a degree in teaching,
Okay.
but she said this is boring. I don't want to do this. But she loved working on cars. So she was the first female engineer to be working on a train. So
Really?
she worked on a train as an
Wow.
engineer for
And she played
25.
golf.
She picked up golf later on.
Because
She's a
someone once told me that golf means girls not something like that, but that was a mnemonic. It was a joke. The early founders of golf didn't think women were allowed on the golf course,
Oh,
so
okay.
somebody made up this GOLF, meaning girls are not allowed or something, not on the golf course, stuff like that.
We
But
don't
obviously
remember
that's
those
not
kinds
true.
of. No, no, it's not. No. So when you say that, they were not afraid. My mother had great faith. They
Mm,
taught me. They. One thing my dad did before I went off to college, he brought me in, sat me down, and had a conversation. We will back you with whatever you want to do as long as you follow these rules. And I thought, okay, I'm gonna do that.
okay. Wow. So what was your experience in Meharry? I mean, it was a private college. Obviously, it was more expensive than a state college. It was, but you got a scholarship when you the
No,
private
no, no. So
the
it
health
wasn't
service corps.
yeah, the health
Right.
service corps. So when I went to Meharry, that was more of a shocker than any
Okay.
place, because here you're taking um, kids from all over the country.
Right.
So these were people that fathers and mothers were physicians, and so I went to in school with people that were accustomed to a lot of stuff
Hmm.
anyway. So we had people from New York, from L.A. They were from all over the country. Now, also at the time, this was in we finished in 82, 78 to 82. There was about 35 to 40% of our classmates were Caucasian.
Okay.
Uh-huh. So that, Meharry was not exempting anybody
Anybody,
as long as
right.
they had good metrics.
Right.
They were accepted as well.
Right.
Uh-huh.
I know you guys had opportunity to train at, Nashville, Vanderbilt, and all that.
Hmm.
Was that where you cut your teeth, interest in cardiology, or?
Right. So cardiology started there. Being a physician was when I had chickenpox. I didn't know anything about being a cardiologist. So as a young um, freshman, medical school was tough. It
Hmm.
was a lot of information, um, a lot of reading. I was a chemistry major. I was not, biology major. They're used to reading. I'm used to, some formulas, and you figure that out, and you're done. So that was a big transition for me, even to the point where the cardiology was chosen because of a failure. And so then I said, oh, well, wow, I like physiology. I didn't know anything about it because I had to
Right.
now spend time to read it, study it, and that was my interest.
Oh
And I
wow.
have not had a failure since
Oh
then.
wow.
Yeah, it
So,
was
have you ever had any in your career as a cardiologist? And you can be honest because there's a lot of people watching who are curious. Have you
uh,
ever had any chauvinistic remarks
oh,
because you're a female interventional cardiologist? And
of course, of course. When I came back to practice here, I recall taking a patient to the cath lab in the middle of the night, and for here, they were not accustomed to, number one, the female going in, rushing in, and doing a angioplasty. Not just the angioplasty, but it was an angioplasty on the left main. And I remember this guy was sick, was in heart failure. I mean, just going down, wasn't doing well. I stented his left main, and the next day they were like in uproar. Oh, how did you do that? Oh. Now, one of the surgeons made a little snide comment. These are called microaggressions now, right? But he made a comment that you ought to be at home cooking or, baking cookies or something like that. People ask me, you get upset about that? No, I really didn't. I just ignored it because that was his problem. It wasn't my
the
problem.
patient did well.
Oh
That's
yeah,
what matters to
yeah,
you,
yeah.
right?
Uh-huh. But I mean, why would I get all in a tight wad about that? I've had, um, you know, when I was a resident at Henry Ford, I trained at Henry Ford Hospital, and I recall as a fellow, one of the patients told my other fellows they did not want anybody of color, no blacks, and no women to do a heart catheterization on them. Well, I didn't know anything about that. We usually go sign up for cases the day before.
Okay.
And so my group, it was 5 fellows. We were pretty on top of it, and we were always anxious to do the next case. Well, this patient had a lot of stuff that he needed to do, and I signed up for the one that had the most stuff. And they said, "Here, Myrna, go and sign up for the person that said they don't want them to treat them."
The patient said he didn't want a
Yeah, the
female
patient
or a
said a
African
female or an
American,
African American working
and
on
he
them.
was a who
He
was
was
the patient?
Caucasian. He was
Male.
Caucasian male.
Well,
Right,
wow.
Caucasian male. So my professors went and told him, "Hey, you don't have any choices in this institution like that. And so I mean, I did the case with my professor
Right.
who did it with me. But
Wow.
that's what I'm saying. I did not experience a lot of um, differences among my
Among your
colleagues.
colleagues,
My,
right?
I mean, my colleagues, no, may have been from the patients
Hmm.
or the patients. When I
Family,
came back
relatives,
here,
yeah.
I remember taking a patient to the cath lab. He had a heart attack. Taking him to the cath lab, stented him, and the patient did well. The next morning, he says he wanted another doctor.
Oh.
That was at one of the hospitals in Jackson. Yeah,
My
and
my
so
residents always complain, the young female residents, they when they walk in, the nurses,
uh-huh.
or let me say, the patients think they are nurses.
Hmm.
I said, can you tell the doctor to call and come in? And they're like, but you rightly said, there's no reason getting upset.
Yeah.
It's
So
just
when I was a young doctor, I used to get upset until I went to I went to a conference when I was an interventional fellow. One of my co-fellow and I were with our young staff, and we were so amazed. And we went to this interventional conference. The interventional conference is like going to the movies for it's like the movies that just come out, and so you see all of the new equipment, all of the new everything that's exciting about
right.
medicine. And we were there, and so I said, hey, boy, there's a lot of women out here. There's a lot of doctors out here. And so the guys with me, my co-fellow, says, those are not doctors. I said, how you know that? Oh, we can tell the difference. Meaning they were nurses, and the nurses were the nice, cute women, and the doctors looked drab. And so I thought, okay, that is not going to be me. Okay. And so now when somebody said, you look like a nurse, I said, okay,
That's
that's
a
a
compliment.
compliment. That's a compliment.
So
But you have to learn that
you
kind of
have to
stuff.
learn to turn things to your. Don't. There's no need getting flustered over things,
Over
right?
that? No.
Yeah.
I don't worry about
Well, that's
that.
the right attitude. A lot of people get flustered
I
and
used to, but
get
I
frustrated
no.
and
Mm-mm.
make a storm and.
I say, ma'am, can you give me some tea? Say, yeah, I get you some tea. Here.
Tell-
And then they realize I'm the doctor. Then they want to come to my office.
right, to make up for
No,
past.
no, no. They just see, okay,
You're
uh,
courteous,
yeah.
right?
Well, one of the questions you had for me, and I thought, who am I? I'm a servant.
Right.
We are servants. If we go into medicine as servants, we are serving people,
That's
and we're serving God's people. Um, you won't get in a tight wad about comments like that.
right. Reputation and all that.
Yeah, right.
Tell me a bit about women with cardiac disease. You gave a talk to my department some years ago. I think you came on the cardiology heart month for
Yeah.
women,
Okay.
and you were trying to canvas for us to come and participate. But you basically said at that talk that there's a difference in the symptoms for women with cardiac disease.
Good. I'm glad you
Yeah.
switched that from me to
No,
now the people with heart disease. So there are differences in presentations of women with heart disease, and that's one reason I've kind of stuck in there. When I was an interventional fellow, one of my staff said, "Hey, Myrna, why don't you should start doing these talks about women and heart disease?" I thought, I don't want to do that. Okay, it's sort of like, okay, that's beneath me. No, I want to put stents in, and I want to do angioplasty, and I want to do the big time stuff too. I don't want to do that. Well, then I realized how many women were affected by physicians' attitudes of
uh,
that they didn't have any disease. There's a lot of, okay, well, I didn't realize she didn't say she had chest pain. She said she had tightness in her neck when she walked or in her arm. And so certainly we have discovered that women do present differently.
differently. Right.
Not always. The most common presenting symptom of myocardial infarction is still chest discomfort. Not pain, but chest discomfort. And then there are other atypical symptoms such as shortness of breath, arm discomfort, neck discomfort. But it took some research for women in medicine to bring that to fruition. I mean,
Oh,
there's a lot of people before me that has brought that information to the public to prove that we present differently.
right.
Yeah.
And I think the statistics still say there's more cardiac, I'll use the word deaths, I'm not sure, but that's what I read. There's more cardiac deaths in women
Yeah.
than men. Men tend to die earlier, but overall, women tend to have cardiac disease later, and then there are more fatal outcomes eventually long term.
Yeah,
So
that's
men
true.
probably don't live long enough to add up the numbers, but
Yeah. But
yeah.
it's the most common cause of death in men and
And
women.
men and women, right?
Yeah, it's heart
And
disease.
you live in a very, the South, Mississippi. I mean, they said we are number one or two for obesity, diabetes, heart disease.
Hmm.
So you've seen your fair share of cardiac disease,
I have.
you
So
know.
I live in Mississippi. We're in Louisiana, but we see both on both sides of
Hmm.
of the river, right? Well, when I was in Detroit, we saw a fair share as well because there was a large population of African Americans in the Detroit area. So Detroit is majority African
African
American, so
American.
that we saw a large population of patients with cardiovascular disease.
What was the poverty level? I mean, it was kind of the same as Mississippi,
Um,
Michigan. I mean, the crime, the poverty, the.
so yeah, at the time I was there, crime was a big factor.
Mm,
Um, you know, a lot of Mississippians in the 40s, 50s, and 60s migrated
moved up
to
there,
north
right?
because there was industry. So now the industries are coming here. We got the Nissan plants, we got
Hmm.
other plants and Amazon plants. So we had job opportunities. Where job opportunities were there in
Hmm.
Michigan and in Illinois, and so many of those patients originated. So their heritage may have stemmed from
From
here,
here,
but
right?
they moved there, so they still have a propensity to have hypertension, heart disease, but they were still eating the same, doing the same
Yeah, the
things
same
as when they got up there
thing.
to Michigan. Although the lifestyle may have been a little bit better because of
Hmm.
the plants. I mean, there was,
The
all kind
automobile
of, yeah, the
plants,
automobile
right?
plants, the Fords, the Chryslers, there was so
Right.
many there.
Yeah, those are the
Yeah.
big Ford, Chrysler, and what's the third one?
Dodge and
Dodge and.
yeah, I mean Toyota plants. There's a lot of plants around there.
Mm.
Yeah.
I mean, we all read a book as young doctors, Gifted Hands by Ben Carson, how he was a young student in Michigan, Detroit,
Hmm.
and he tried to stab his classmate and the knife broke. He hit the buckle belt. So it gave us that picture that Detroit was a high,
Crime rate.
violent rate. But he eventually ended up topping his class and going to, I think he went to University of Michigan for medical school. Then
Hmm.
went to Yale he went to University of Michigan, I think, for undergrad. Then went to, I think, Yale for medical school, something like that.
Yeah, I'm not sure
Yeah,
either.
yeah,
Yeah, I read that book years ago.
yeah.
As well.
So I want you to tell my audience what are the signs of a acute myocardial infarction. That's the word we use, I presume, for a heart attack.
Right.
Because it's the number one killer, and some people still die at home in the 21st century, which I just have a hard time understanding.
Right. Okay, so when you think about heart disease, it's an umbrella. So that umbrella would encompass anything that's coming from the heart or the blood vessels from it. So when we say cardiovascular disease, we're talking about the heart plus the vessels. So the heart is about the size of my fist, and then there's some vessels that come off the heart that go to the neck. Those blood vessels supply the brain. That means that if there's a blockage in the carotids, then you can have a stroke. So a stroke is decrease in blood supply to the brain, and a heart attack is decreased supply to the heart. And so just like these little vessels on my hands, there's some vessels on the heart that supply the blood vessels to the heart. Now those little small vessels, they're very small, but they can get plugged up with atherosclerosis, which is hardening of the vessel. So when those blood vessels start to narrow and there's a decrease of amount of blood to the muscle, then that patient may feel some discomfort. And we talked about that earlier. That may be chest tightness, that might be shortness of breath, discomfort going to the neck, to the back. So, number one, the patient has got to know what the symptoms are of heart disease before they can go, right? So sometimes they're confused. They think it's heartburn, so the esophagus runs right down
Right.
the chest as well, and they think, oh, well, it's probably something I ate and it just won't go away. But we tell you, or we tell patients, If you feel this chest discomfort and it's not going away with your traditional burp and it's going down your arm and you're feeling tired, it makes you feel tired because that muscle's not moving. Then that is signs of a heart attack. You should call 911, and when you call 911, they have a certain amount of time to get to you. We try to do it in less than 10 minutes. And if they get to you in the right time, they take you to the hospital. If you can get to an institution that provides angioplasty, and I didn't bring any of my models, but there's a way that we can put a little small stent in the blood vessel and open that blood vessel so that the blood flows, and that would relieve the discomfort. One of the main things that we want to do is supply blood to the muscle so the muscle can work better. You already know that. I'm just letting them know that.
Right.
If the muscle works better and they can get there within 90 minutes, that decreases that person's risk for death. Okay, 90 minutes if we can get that blood vessel open. So when you stay at home and you're prolonging it and you want to wait till the next morning, I've had people, oh, it's Christmas and I want to wait till the next morning. By that time, the muscle, that muscle that's squeezing, is dead. And so even though they may go and open the blood vessel, it may not recover. If you can get there before 6 hours, you got a good chance. So between 0 to 6 hours, you got a good chance of getting the muscle going and no damage. But if you between 6 and 12 hours, still come to the hospital because you can die. If you between 12 and 24 hours, still come, but your chances for recovery is much smaller. And so we would like you to come urgently to the emergency room. Now, if you're in a small town, we have helicopters to take you to large places and we are well equipped to diagnose myocardial infarction. Now we got these beepers and cell phones, and our emergency medicine staff look at an EKG. They send that EKG directly to us. We look at it. We say, hey, this is a myocardial infarction. And then we can start the treatment right there in whichever emergency room there is. And then if there's something that needs to be sent, you can go straight by ambulance if it's a short distance or by helicopter.
Wow. You shared a story when you came to give us a talk. You said one of the reasons women have more cardiac disease, fatal outcomes, is when they come to the ER, they have their makeup.
They gotta wait. Wait a minute. Let me go take a shower. Let me go get my purse.
And nobody thinks they're having a heart attack
right, they
because
don't
they look so good.
Right.
So we're talking about the #1 killer in America, cardiac disease. We're going to continue this talk next week with Dr. Myrna Alexander. You don't want to miss it. God bless you. Jesus is Lord. Amen.